And welcome back. Today is Melanoma Monday, a day to raise awareness about the dangers of skin cancer. And we're joined by Timothy Jochen, a local dermatologist. And good morning, doctor. You know, I just told you I'm not awake yet, but sitting next to you, I'm awake. Bright orange. What's up with the bright orange today?
This is to signify Melanoma Awareness, Melanoma Monday, awareness of melanoma, which is a deadly form of skin cancer.
Yeah, and you know, you've been talking with me about this morning, and it's very interesting because here we live in the desert where a lot of us take the sun for granted and don't take much concern with the fact that it could really kill us.
Exactly. Well, melanoma is the most deadly form of skin cancer, and the nice thing about melanoma is it's on your skin for you to see, unlike a lot of forms of cancer where you can't see it, like lung cancer, breast cancer, but these are on our skin, so if we catch them early, we can actually cure them.
Well, now, what are some steps that we can take as on our own to notice these changes?
Well, a lot of people want to know that, and we have the ABCD that we look at when we're evaluating our moles. So if you have more than 50 moles, you're actually at an increased risk of developing melanoma. So you really want to keep track of your moles and look at them, you know, routinely. And you can use the ABCDs to determine whether they're atypical or not. Now, if you have them, I really recommend that you go to a dermatologist to have them evaluated because we have a trained eye to see that. But the A part is asymmetry, so one side of the mole doesn't look like the other part.
Do you, I'm sorry to interrupt you, but quick question. When you say if you have more than 50 moles, what if you start developing moles? I mean, isn't that a sign as well, or is it not?
Well, we develop new moles up until the age of 50, and then we start to have our moles start to go away after the age of 50. Yes. So it's not unusual to get new moles, but if you have changing moles, that's a sign that you need to get to a dermatologist and have them evaluated.
Okay. And you said that there's something that's kind of frightening, and is that people are now using apps to check for moles?
Now, there are apps on cell phones where people can look at their moles and determine whether they may be melanoma or not. But scientific evidence is showing that they're not accurate in diagnosing melanomas or not.
And you brought this with you to tell us.
Oh, sure. This is a device.
This is a real deal. This is not an app that's on your phone.
Yes. This is called a dermoscope, and what dermatologists do is they look at your moles under this magnification to actually look and see if there's any atypia in the moles to determine whether we need to take them off or not. So it's a really good device, and about 50% of dermatologists are using these now.
Well, that's fabulous because you can, by the trained eye, see something, and that's a big mistake that people are making. But very quickly, let's finish what you had here with the ABCDs.
Sure, of course. So we talked about A, where it's asymmetrical, one side doesn't look like the other. B is border irregularity, so they're not round and smooth. C is color variability, and so if you have multiple colors in your moles, they can be bad. And darker moles are worse than lighter moles. And then diameter greater than 6 millimeters, which is about the size of a pencil eraser, is also bad. And then finally we add E, which is evolving, or what we talked about was changing moles. If your moles are changing, then you really need to go and see a dermatologist.
And you also told us that something very frightening that I think the one area where people feel comfortable is that you're thinking women that are young, they're okay, they don't have to worry about skin cancers for old people. Not the story anymore.
Not the story. In fact, young women are the group that has the highest increase in rates of melanoma. The increase has gone up about
sunbathing?
Tanning beds. Yes. They attribute it to use of tanning beds. Okay. So yes, it is on the rise.
Well, I appreciate you coming in today and spreading the news and hopefully bringing some good news to people as well, that they take care of themselves. And bright orange is the color of the day. Dr. Timothy Jochen, talk with him if you have any concerns. And thank you so much for coming in so bright and early this morning.